From Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about mental health during the holidays and resources available for those who need them. Our guest today is Terry Cassidy, the Executive Director of Behavioral Health Services at Sarasota Memorial. Terry, thanks for being with us.
Thanks for having me, Allison.
The holidays can be an amazing time. Joyous for so many, of course, but not for everyone. So can you talk a little bit about the holiday blues?
Sure. Those infamous holiday blues that so many people experience. I think many of us are aware of them. They typically start emerging around Thanksgiving through the busy time of the holidays right up until, the 1st of January. And usually it's a feeling of, we start feeling maybe twinges of sadness, maybe anxiety, maybe we're a little frustrated, we're tense, we're stressed. And that's the holiday blues.
So you talked about some of those feelings. What are the true signs and symptoms of true holiday blues versus just stress or anything else?
Okay, it's the difference between the holiday blues is certainly not a mental illness. It's just there's so many so many senses are being awakened during the holidays. We smell things, cookies baking, turkeys cooking, hams baking. We hear music that we hear every year, and it brings back memories. It might be a holiday plant that smells familiar. There's sounds. There's pretty much it tantalizes every single sensory, our 5 senses, and that elicits all kinds of memories. And we can have twinges of if somebody has suffered a loss of a loved one, suddenly you're feeling very sad and you know that this year's going to be very different. That person's not there. And even if it's not a recent loss, it's somebody that's not there, that had been there. So it could have been a death of a family member several years ago, and you still, during the holidays, all those feelings come up. It also can be maybe not even aware that you're stressed about your budget. You're making your list, you're thinking of all the people you want to please, all the gifts you need to buy, the food you're bringing for parties, all these demands that are happening on your budget, and wondering, can you get through? Can you please the people that you love? So you have that. And then if you are alone, and perhaps you're not married, perhaps you don't have family or friends that are very close, you're hearing about other people's gatherings. And you're feeling alone, and it makes you feel maybe unworthy. And the more you hear these conversations, the more depressed you might become. So there's so many contributing factors to the holiday blues. And sometimes it's just a fleeting feeling of sadness or anxiety or stress over the budget, or sometimes it's just persistent throughout the holidays. It just kind of ebbs and flows.
Are some people more at risk to those holiday blues than others? I mean, I recognize that you said, not a true mental illness, but if someone already has anxiety or depression, are they more at risk for feeling these holiday blues?
Well, it's great that you asked that question, because the National Alliance for Mental Illness, which is a wonderful organization made up of people with mental illness and their family members to support them, and they do a lot of research. And what they've discovered that about 65% of people with a mental illness, whether it's anxiety, depression, or any other mental illness, are more apt to have symptoms exacerbated during the holidays. So that is a high-risk population.
When do you know that someone has crossed the line from holiday blues to maybe something more severe, like true depression or anxiety or something like that?
That is a wonderful question, because like I said, a lot of us can experience moments of holiday blues. But it's a couple things. It's if you're feeling depressed every day to the point that you're unable to maybe function with your daily activities. It's difficult to go to work or go to school or make a meal for your family or for yourself. You're not sleeping right, you're not eating well, changes in specific habits. You're feeling maybe hopeless, helpless, maybe despair, all those things. are contributing factors. And if they're lasting for more than 2 weeks, certainly it's an indication you might be suffering from major depression. Another big risk factor is if you're having any thoughts of death or suicide.
Absolutely. With the holiday blues in particular, what coping strategies do you recommend? How do you recommend people experience those feelings and then move past them?
Okay, well, it's really being tuned into yourself, recognizing what is it that's triggering you. Is it the budget? Then setting limits around the budget. Okay, maybe you're going to propose, I know we did this in my family when the family got so large, it was, okay, why don't we do a swap? Buy one gift for the adults and we actually had a lot more fun doing that. And then buy gifts for the kids. Maybe homemade gifts. Maybe you start shopping throughout the year, spread out the spending, and just be upfront with what you're able to do. Just set that budget, try to stick to it. If you find that overextending yourself is creating, because we all think, we have to be the super host, we have to have the best parties, we have to have just remember everybody, just outdo everything. It's all over the top for the holidays, isn't it? And so we're trying to keep up, and there's so much stress in that. So recognizing what events really do you need to go to? Set limits for yourself. Know what you can and cannot do. Try not to be weighed down by the shoulds and the guilty feelings, or volunteering to bake this and be there. So that's a big factor. And I would also say keep into your routines, keep into your structure. If you're somebody who likes to walk every day, continue to walk. If you're somebody who goes to sleep at a certain time, continue your sleep. Try not to overindulge in alcohol. Try not to overindulge in all the wonderful food and festivities that come out during the holidays, but just try to, keep yourself healthy.
Absolutely. Is there a good way to prevent the holiday blues altogether?
Well, I don't really think so. I think being aware of what is your triggers, again, all those things, if it's a loss of somebody, if it's feeling of loneliness, if it's feeling overcommitted, just recognize what it is and do what you can to mitigate those feelings. Again, if it's loneliness, what can you do to feel more connected to people during this time of year? Maybe you volunteer somewhere, maybe you reach out and call an old friend, maybe you go to a local social gathering, a neighborhood association gathering, just trying to push yourself beyond your comfort to make those social connections.
Do you have any recommendations for family or friends who might be watching a loved one experience some of those holiday blues? How can they offer support? How can they help them get through that?
Well, I think it's, having those conversations, identifying it and saying, I'm concerned about you. It seems like, and detail or describe the behaviors that you're seeing. You haven't returned my calls in a while. I'm really concerned about you. At the same time, you don't want to be pressuring or judgmental. You want to be reassuring and letting that individual know you're really there for them and you'd love to support them however you can. But sometimes I think just having somebody point it out, because sometimes we're not aware of what's going on for ourselves, especially if we're so overwhelmed.
Now, if someone is seeing a loved one or they themselves are experiencing the more severe depression like you're talking about, how do you recommend they go about seeking help?
Well, if somebody is feeling suicidal to that degree, as of last July, we have a 3-digit number for a 988 suicide hotline, 24 hours a day, staffed with licensed therapists that can really help you through the crisis and link you to local services as needed. So they're available 24 hours a day. Now, if it's not to that degree, perhaps you're feeling depressed and sad and just recognizing you need some additional support and professional help. There's several ways you can go about doing that. If you're employed, a lot of employers have employee assistant programs that are free of charge and can provide you just brief sessions. You can contact, if you have insurance, usually on the back of your insurance card is a behavioral health line. And you can call that and they can tell you who's available in your area and what your insurance coverage and everything really should be covered. If you don't have that, you can go, and I love this website, it's Psychology Today, And it lists all the local providers. You even get to see a picture of them, what their degree and specialty is, and how long they've been in practice, and really whether they're accepting new clients or not. So it's a great resource.
What are some of the most common misconceptions about mental health that prevent people from seeking the help they need? They might think to themselves, oh, my depression isn't as serious because I'm not suicidal, or, oh, I'm doing okay. I'm getting out of bed in the morning. That's the best I can do. Why do you think people don't seek the help they need?
It's we're making progress in this, but again, it's a lot of times people feeling it's a weakness to say they need help. When, if you think about it, when it comes to a medical illness and we're suffering from any medical condition, is it a weakness to call your physician and say, hey, I need an appointment, I'm suffering from this? It's the same thing with a mental illness. It's an illness that needs to be treated. And if people can move beyond that feeling like, oh, I just got to suck this up and put on my, strong face and move forward, it doesn't work that way. People really need to reach out and get help. And I tell you, when you hear testimonies from people that did this, it's amazing when they say, oh my gosh, when I finally got help, I had no idea how good this would feel to get this off my chest, to learn these skills, to be able to really talk about this. And it's life-changing for many people.
Other than, of course, the obvious, that if someone is suicidal, that is obviously, as you said, an emergent situation. But what are some of the longer-term risks that can happen if someone experiencing depression does not get the treatment they need?
Untreated depression or any mental illness has just so many negative outcomes. It can impact your physical health tremendously. In fact, it's amazing how many people end up in the hospital because of untreated mental illnesses, and then it goes to other things like heart disease and diabetes for a variety of contributing factors. So it does have very, very consequential outcomes if it's not addressed.
That leads me to something exciting we want to talk about, because there are going to be some big changes to people in our area seeking treatment. Little gift for the holiday season, if you will, because the Cornell Behavioral Health Pavilion at Sarasota Memorial is now in final stages of construction, going to open this holiday season. Why is that going to be so important for this community?
Oh my gosh, it is a game changer. We have been talking about this, planning it, designing it, constructing it for the past several years, and it is a state-of-the-art, amazing facility. Everything about the design was intentional and so well planned that the whole pavilion is designed to promote recovery and well-being. And so the colors, the lighting, the sound, and then we just have a continuum of services in it, from intensive outpatient services to 24-hour assessment center to a 24-hour call, emergency crisis call line, to inpatient units. It's beautiful.
And how does that differ from the current behavioral health hospital at SMH, or even behavioral health hospitals you've seen elsewhere?
Right. Well, our current building was built 50 years ago, and it was never designed for the population we're serving. And I've always commented on the amazing team of healthcare providers I work with every day in our behavioral health pavilion that are wonderful, but they're working against an environment. For example, it used to be an old nursing home, so the ceilings are low and it's dark and there's not light in there. It's like crowded. Some of the rooms are triples and doubles, and to go into another room with other people in a mental health crisis on your worst day of your life is not a comfortable feeling. The new pavilion is mostly single rooms, and it's light and it's bright and it's airy and it's just really beautiful. So also the innovations we have, I love this, is that people that are coming from the inpatient facility, we can actually introduce them to their counselor in the outpatient facility before they leave. So now that it's more of an opportunity to build rapport and feel comfortable with that person, so that the chances of them returning for the next level of care are very high. So we're very excited about that.
Can you talk about how needed this is in this community? Because again, mental health is so important and something that's been talked about more and more.
Yes, a lot of people have heard this number, but I can't say it enough, but 1 in 5 individuals have a mental health illness. That's 20% of our population. And so if we just look at just Sarasota itself of 400,000 people, that's 80,000 people with a mental illness on any given day. So that's huge. So the numbers are large, and it's actually increased since the pandemic. I think we've all heard this, we've become very aware of it. So the need is tremendous, and we have not had adequate services here. And as we know, SMH is all about really taking care of our community. We've recognized we needed to do more for behavioral health, and we are.
What are you most looking forward to with the new Cornell Behavioral Health Pavilion? Because I know there's so many exciting things about it, but what are you most looking forward to?
I am so looking forward to when we move in. I want to see just the expressions on the patients' faces when they see, and our clients coming in through the outpatient. It is, anybody that comes in right now and tours is just overwhelmed with how wonderful the pavilion is. It's just amazing. So that's what I'm really looking. And the staff, they're so excited. They're very eager to get into the new pavilion.
Absolutely. Well, before we wrap up our conversation, I wanted to check if there's anything else you want to add as we prepare to enter this holiday season for someone listening to this or watching this podcast, as they prepare to possibly face some holiday blues or interact with some of their family members and friends.
You know, I would say just knowing November, December are here, to be very aware of what are your triggers, what are the things that stress you out. Know your expectations, because we all have that hallmark expectations of what the holidays should be about, but be realistic about that. Think of your family system. Think of the conflicts in your family. Think of the struggles and recognize it for what it really is going to be. Try to be very realistic about it, and then try to create a plan to help you through these situations. Again, if it's family that might be stressful, figure out what you can do to lessen that. If it's budget, what you can do. Maybe even plan something for after the holidays that you can look forward to.
Great advice. Terry Cassidy, thank you so much for joining us today.
Thank you, Allison, for having me.
As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.